Hi friends, welcome back to 1000 questions and answers series. First question, patients with a cystine stone advised to take low purine diet, low oxalate diet, low fluid intake and low protein diet. The answer is low protein diet. Next question, the surgery done for pelvic ureteric junction obstruction is called pyeloplasty, urethroplasty, ureteric reimplantation, nephrectomy. The answer is pyeloplasty. The urethral opening in the ventral side of penis is called epispadias, hypospadias, extrophy of bladder, fistula. The answer is hypospadias. The surgical correction of hypospadias is urethroplasty, pyeloplasty, urinary diversions, ileal conduit. The surgery is known as urethroplasty. The heart begins to beat in the developing offspring at conception, at 6 weeks of development, at birth, at 3 to 4 months of development. And the answer is at 6 weeks of development. Which of the following changes in acid-base balance occurs in normal pregnancy? Options are decrease in serum hydrogen concentration, reduction in plasma bicarbonate, increase in total base and acidosis. The answer is reduction in plasma bicarbonate. Next question, the increased pulsation felt through the lateral fornices at 8 weeks is called Chadwick sign, Osiander sign, Goodell sign, Piscasex sign. The answer is Osiander sign. Next question, which term is used to denote the perception of active fetal movements by the woman? Lightning, palpation, auscultation, quickening. The answer is quickening. Next question, asymmetrical enlargement of the uterus if there is lateral implantation is termed as Goodell sign, Osiander sign, Piscasex sign, Hagar sign. The answer is Piscasex sign. Next question, regular and rhythmic uterine contraction which can be elicited during bimanual examination at 4 to 8 weeks is called Hagar sign, Osiander sign, Chadwick sign and Palma sign. The answer is Palma sign. In vertex presentation, the denominator is occiput, mentum, brow, sacrum. The answer is occiput. In face presentation, the denominator is occiput, mentum, brow, sacrum. The answer is mentum. In face presentation, the denominator is mentum. Next question, in brow presentation, the denominator is occiput, mentum, frontal eminence and acromion. The answer is frontal eminence. Major postoperative complication of prostatectomy is urinary incontinence, bleeding, infection, loss of sexual function. Answer is bleeding. The obstructive and irritative symptoms of benign prostatic hyperplasia is collectively known as prostatodynia, prostatism, enlarged prostate, dysprostasia. The answer is prostatism. The major cause of epididymitis is Staphylococcus aureus, Streptococcus E. coli, Chlamydia trachomatis. And the answer is Chlamydia trachomatis. The persistent erection of the penis is known as phimosis, balanitis, priapism, ochiopexy. It's known as priapism. Next question. The presence of fibrous plaques in the sheath of the corpus cavernosum is known as priapism, Peyronie's disease, circumcision, and phimosis. Peyronie's disease is the presence of fibrous plaques in the sheath of corpus cavernosum. Next question. The primary purpose of aluminum hydroxide gel in renal failure is to prevent metabolic acidosis, relieve gastric irritation, prevent gastrointestinal ulcer formation, and bind phosphates in the intestinal tract. The answer is bind phosphates in the intestinal tract. Next question. Which of the following cranial nerve is not involved with the eye? Accessory nerve, trochlea, optic, abducent. The answer is spinal accessory nerve. Next question. Invasion of body tissue by microorganisms and their proliferation is disease, inflammation, infection, and asepsis. It's known as infection. Practices to destroy all microorganisms and spores is sepsis, cleaning, asepsis, sterile technique. And the answer is sterile technique. Next question. Freedom from disease causing microorganism is asepsis, cleaning, sepsis, none of the above. It's known as asepsis. Hepatitis A is an example of direct transmission, vector-borne, vehicle-borne, airborne. The answer is vehicle-borne. Hepatitis A is an vehicle-borne infection, mainly through food. Agent that inhibits the growth of microorganism is disinfectant, antiseptics, sterilization, moist heat. The answer is antiseptics. In breech presentation, the denominator is mentum, occiput, sacrum, frontal eminence. The answer is sacrum. In shoulder presentation, the denominator is sacrum, frontal eminence, mentum, acromion. The answer is acromion process. Next question. How many positions are there with age presenting part? 7, 8, 6, 5. The answer is 8 positions. Next question. Which one of the following is the commonest position in vertex presentation? Left occipito anterior, left occipito posterior, right occipito anterior and right occipito posterior. The answer is left occipito anterior. How many types of sutures are present in fetal skull? 4, 3, 5 and 6. 4 types. The answer is 4 types. Anterior fontanelle is otherwise named as brecma, lambda, vertex, occiput. The answer is brecma. What is the shape of anterior fontanelles? Triangular, diamond, cuboid, rectangular. The answer is diamond shape. Isotonic exercise such as walking intended to increase muscle tone, increase endurance, increase muscle size, deplete muscle oxygen. Isotonic exercise is for increase muscle tone. Next question. Grinding of teeth during sleep. Nocturnal enuresis, bruxism, somnambulism, sleep talking. The answer is bruxism. Next question. Somnambulism is sleep talking, limp movement during sleep, nocturnal enuresis, sleepwalking. Answer is sleepwalking. Difficulty in obtaining adequate amount of quantity of sleep, hypersomnia, insomnia, sleep apnea, none of the above. The answer is insomnia. In the process of glycogenesis, which of the following is converted into glycogen? Carbohydrate, protein, fat, vitamin. The answer is carbohydrate. The essential amino acid is leucine, glycine, alanine, aspartic acid. The answer is leucine. The non-essential amino acid is methionine, tryptophan, phenylalanine, proline. The answer is proline is an non-essential amino acid. Patches of hypopigmented skin caused by destruction of melanocytes. Pallor, cyanosis, erythema, vitiligo. The answer is vitiligo. A flat, unelevated change in color of skin, papule, plaque, macule, nodule. The answer is macule. Elevated solid hard mass that extends deeper into the dermis is macule, papule, plaque, and nodule. The answer is nodule. A circumscribed round or oval thin translucent mass filled with serous fluid or blood is pustule, vesicle, nodule, cyst. It's known as vesicle. Larger elevated fluid filled or semi-solid mass arising from subcutaneous tissue. Options are vesicle, nodule, cyst, and papule. The answer is cyst. Vitiligo is an example of papule, macule, plaque, and nodule. The answer is macule. Next question. Fibroma is an example of macule, papule, plaque, nodule. The answer is nodule. Flat irregular area of connective tissue left after a wound is healed as scar, fissure, keloid, scale. The answer is scar. Next question. Iron deficiency anemia results in clubbing of nails, Bue's nail, then spoon-shaped nails, cyanotic nail. The answer is spoon-shaped nails. Loss of elasticity of lens and result in loss of ability to see close objects is myopia, presbyopia, hyperopia, astigmatism. The answer is presbyopia. And the last question. Inflammation of lacrimal sac is conjunctivitis, hordeolum, celatinitis, dacryocystitis. And the answer is dacryocystitis. And thank you to everyone.